The discovery of antibiotics marked a turning point in human history. These wonder drugs, capable of vanquishing deadly bacteria, revolutionized medicine. Infections that once spelled certain death became treatable. Surgical procedures became safer. Life expectancy soared. The world had entered a new era of medical prowess. However, this victory was not absolute. Even as antibiotics were celebrated for their life-saving potential, a subtle threat emerged. Bacteria, those microscopic entities with their remarkable ability to adapt, began to evolve. They developed mechanisms to resist the very drugs designed to destroy them. This phenomenon, known as antibiotic resistance, cast a long shadow over the miracle of antibiotics. Nowhere is the crisis of antibiotic resistance more acute than in India. The rampant use and misuse of antibiotics has created a breeding ground for resistant bacteria. A potent cocktail of factors has fueled this crisis. Over-the-counter availability of antibiotics, without the need for a prescription, has made them easily accessible. This easy access has led to the perilous practice of self-medication. Driven by a lack of awareness and limited access to healthcare professionals, many Indians resort to self-prescribing antibiotics. Often these medications are taken inappropriately for illnesses they are not designed to treat, such as viral infections. The consequences of antibiotic misuse extend beyond human health. In India, antibiotics are widely used in agriculture, particularly in poultry and livestock farming. This practice, often unregulated, leads to the proliferation of resistant bacteria in animals. These bacteria can then find their way into the food chain, ultimately infecting humans. The public health implications of antibiotic resistance are profound. Infections that were once easily treatable are becoming increasingly difficult to manage. Tuberculosis, a disease already endemic in India, has been exacerbated by the emergence of multi-drug resistant strains. Hospital-acquired infections, once a rare occurrence, are on the rise, posing a significant threat to patients, particularly those undergoing surgery or receiving cancer treatment. Recognizing the gravity of the situation, the Indian government has taken steps to address the issue. The National Action Plan on Antimicrobial Resistance, or NAPAMR, launched in 2017, outlines a multi-pronged strategy. Key initiatives include regulating antibiotic sales, raising public awareness about responsible antibiotic use, and strengthening infection control practices in healthcare settings. However, much more needs to be done. Stricter enforcement of regulations is crucial to curb the over-the-counter sale of antibiotics. Improving healthcare infrastructure, particularly in rural areas, is essential to provide people with access to qualified medical professionals and discourage self-medication. Public awareness campaigns are vital to educate the population about the dangers of antibiotic resistance and the importance of responsible antibiotic use. Finally, global collaboration is essential to share knowledge, resources, and best practices in the fight against this global threat. The time to act is now. The future of our health depends on it.